I'm Dr. Brandon Czekaj with Health Rehab Chiropractic, and I'm gonna go ahead and go over the anatomy of tennis elbow, or also known as lateral epicondylitis. Most common area of pain is right through here, where the common extensor muscles attach. Other areas can be below, right at the joint, and above, where the tricep is involved as well too. There's 5 different muscles and tendons involved with the muscle, and what happens is through a lot of repetitive movements, there can become extensor injuries, typing at the computer, yard work. A lot of repetitive movement with the hands can aggravate that area. There can be inflammation, muscles get aggravated, tighten up, and aren't moving properly, and that can cause some irritations to the nerves, cause inflammation. Most common area of discomfort is right through here, but sometimes the pain can start here and travel up. When it's a little bit more complicated is the farther it goes up as well too. When it involves joints, sometimes that can be some extra inflammation that's happening here and aggravating here, but it can take a little bit longer when the tricep is involved as well too, because there can be some complications with the shoulder, and that can usually been going on for months at that point there. So overall, it's 5 muscles get inflamed, aggravated, and we want to work on calming it down. Come to the office and we're going to go over some treatment here in just a moment on how we do that. First thing that we start with is doing some electric muscle stem. There's going to be some mild current going between the pads. It's going to help relax the muscles, help pain discomfort, and promote that healing process. After we do the electric muscle stem for anywhere from 8 minutes to 15 minutes to help relax the muscles, usually do that along with some heat. Next, we'll go ahead and do some Groston, or instrument-assisted soft tissue mobilization. So there's a couple different tools that we can use to work on doing some scraping into the muscles and through here. So what this is going to do is break up adhesions, trigger points. We have a couple different tools that we can use to work on doing this scraping of the muscles and tendons in through here. We also have ones that are more contoured to the anatomy as well too, to work on breaking up those adhesions. And once we're done with this, we can go ahead and move on to the shockwave. This is our shockwave treatment. With shockwave, there is a bullet that's going up and down the chamber, hitting a titanium plate and creating a mechanical shockwave that's getting transferred into the tissue. This mechanical shockwave creates a cavitation, breaks up scar tissue, trigger points. It's also creating nanotrauma, which causes small trauma to those tendons and muscles, and it's promoting the healing process and getting blood flow back into the area. We're going to be running the shockwave up and down the extensor muscles. We're usually doing about 800 to 1200 shocks. Patients have been having really great results with about 10 to 12 visits. We've been seeing good changes with tennis elbow. Let me know in the comments if you have any questions, or let me know what conditions you'd like me to review next.